What is DRSABC? DRSABC is a step-by-step primary survey used in first aid and emergency care. It stands for Danger, Response, Send for Help, Airway, Breathing, and Circulation. It's the very first sequence we use when we find someone collapsed or in a life-threatening situation to make sure we act safely and effectively. Indications: when do we use DRSABC? When you find someone collapsed or unconscious. In situations like cardiac arrest, trauma, drowning, choking, or sudden collapse. Anytime you need to check if a person is alive, breathing, and needs resuscitation before professional help arrives. What does DRSABC stand for? 1. D. Danger. Check for danger to yourself, bystanders, and the patient. Example: look for traffic, fire, electricity, or anything that could harm. Remember, don't become the second victim. 2. R. Response. Check if the patient is responsive. By calling his name or ask, "Hello, can you hear me or are you okay?" If unresponsive, apply a deep pain stimulus, either Sternsill rub or trapezius squeeze. 3. S. Send for help. Call emergency number 911/999/000/112 depending on country. If others are nearby, delegate someone to call and bring an AED. 4. Airway. Open the airway and check for obstructions. Normally, use the head tilt, chin lift method. If spinal injury is suspected, e.g., from trauma, road traffic accident, fall, use the jaw thrust maneuver instead, to avoid moving the neck. 5. B. Breathing. Look, listen, and feel for breathing for up to 10 seconds. If normal breathing is present, place in recovery position. If absent or only gasping, prepare for CPR. 6. C. Circulation/CPR. Begin CPR immediately. Ratio: 30 compressions, 2 breaths. Compression rate: 100 to 120 per minute, depth about 5 centimeters in adults. Continue until help arrives or patient shows signs of life. DRSABC is the foundation of emergency response: danger, response, send for help, airway, breathing, circulation. Remember, in suspected spinal injuries, use the jaw thrust maneuver instead of head tilt, chin lift. Knowing this simple sequence can make the difference between life and death in the first few minutes of an emergency.